A recent study has brought renewed attention to the potential of ketamine in treating depression, offering not only promising results, but also critical insights into how chronic opioid use may complicate or even obscure our understanding of antidepressant effectiveness. Conducted by researchers from Stanford University and published in the Journal of Affective Disorders, the study reveals that patients who regularly use opioids show a significantly reduced response to placebo treatments for depression. However, the remarkable finding is that this diminished placebo effect does not seem to apply to ketamine. Its antidepressant efficacy remains consistent, regardless of opioid use. At first glance, this could be seen as a hopeful breakthrough in the treatment of major depressive disorder, especially for individuals whose psychiatric care has been complicated by chronic pain and opioid prescriptions. Yet the implications are not without their warnings. What emerges from this data is a dual narrative, one of potential progress and one of neglected complexity in depression treatment. The study reanalyzed data from a 2023 trial involving 40 patients with severe depression undergoing routine surgery. Participants were randomly given either ketamine or a placebo, and their symptoms were monitored over 2 weeks. The research initially sought to determine whether ketamine could still exert antidepressant effects if its psychoactive properties were eliminated by anesthesia, a novel approach that unexpectedly revealed powerful placebo responses in some patients. But upon closer scrutiny, a disturbing pattern emerged. Those who were also chronic opioid users failed to benefit from the placebo, while their counterparts who received ketamine experienced comparable improvements, regardless of opioid status. The broader implications of this finding are significant and, in some ways, unsettling. Opioids like morphine or oxycodone, widely prescribed for chronic pain, interact with the brain's endogenous opioid system, a network involved in both physical pain relief and emotional regulation. Over time, regular activation of this system through external substances may dull the brain's natural ability to respond to subtle cues of relief or healing, such as those evoked by a placebo. This has major consequences not only for patients, but also for the reliability of clinical trial outcomes, particularly in antidepressant research, where placebo effects are notoriously powerful and difficult to control. Ketamine, however, appears to operate differently. Its mechanisms, while not fully understood, likely involve modulation of the glutamate system and rapid enhancement of synaptic plasticity, effects that remain robust even when opioid pathways are impaired. For researchers, this offers both a rare advantage and a critical caveat. Ketamine may bypass some of the neurobiological obstacles posed by opioid use, but also underscores how much is still unknown about the intersection of pain management and psychiatric treatment. The study's authors caution that this should not be interpreted as carte blanche for ketamine as a universal solution. Ketamine, originally developed as an anesthetic and now used off-label or in controlled clinical settings for depression, still carries risks, particularly related to dissociation, dependency potential, and unknown long-term effects. Its use must be carefully monitored, especially in vulnerable populations. The fact that it appears to work where placebos fail due to opioid interference is encouraging, but it also points to a deeper systemic issue: the underappreciated ways in which common medications like opioids may distort our understanding of mental health treatments and outcomes. This underscores the urgent need for future research that directly examines how chronic exposure to substances like opioids interacts with the brain's response to both real and perceived antidepressant effects. There's also a clear call for clinicians and trial designers to account for opioid history when interpreting data or prescribing treatments. For patients, this research offers both hope and caution. Hope, in that effective treatments like ketamine might still offer relief where others fall short. Caution, in that past or ongoing opioid use may subtly alter their experience of recovery, in ways that require tailored strategies rather than one-size-fits-all solutions. Ultimately, while ketamine's resilience in the face of opioid interference is promising, the findings demand more than celebration. They call for a reassessment of how depression treatments are studied, prescribed, and understood, especially in populations that overlap with chronic pain and opioid use. This new light on ketamine may indeed brighten the path forward, but it also reveals the shadows we've yet to fully explore.